Thanks for the introduction, Stefan. It's always good to be back in Connecticut. I think I've shared with people in the past, I did some of my early years growing up over in Norwalk, spending those winter weekends. Yeah, I was just commenting my early years growing up in Connecticut, just real fond memories. So it's always great to be back with folks. This is a banner day for us. If you hadn't heard earlier today, Representative Rokana reintroduced the State-Based Universal Healthcare Act, the Healthcare Act of 2021. And the State-Based Universal Healthcare Act, as I assume just about everybody knows in the room, but I won't assume everything. We're going to do brief presentations, or Bevin and I, and we'll open it up really more for conversation. We'd rather hear what's on your mind, what you are concerned about, and also a conversation about what can be done. What can we do in this critical moment? Just to say that the outline of the legislation is designed to give an ERISA waiver for each of the states and potentially regional alliances among and between states, up in New England, potentially the Mid-Atlantic, out on the West Coast. There's discussions happening across several states right now, trying to figure out how we can create an even larger single payer pool to have even greater efficiency. And certainly that would work most effectively in the area of prescription drug purchasing, because each of the states has its own peculiar tax structures and so forth. But there are ways that we can couple up and create regional alliances here and bring the power to bear, particularly against the pharmaceutical industry, but also to roll back the big hospitals who are swallowing up the independents, bring power obviously against the big insurance companies. And you in Connecticut know a little bit more about insurance than most, since Hartford's the insurance capital of the US, which makes it even more remarkable, the success that you're having. All eyes are on Connecticut. I mean, I'm in conversations with folks over one-payer states, and you have a very good friend who's the chair of our policy committee. I don't know if he's with us tonight, but Steve Kemble out of Hawaii is always singing the praises of the folks, the work that you're all doing that are doing in Connecticut. So just a quick word of background for folks not familiar with one-payer states, and that is that going back to 2009, I was in my third year of tenure with Healthcare for All Pennsylvania. We began to outreach with other states because we wanted to do economic impact studies and figure out how we can prove what we know instinctively, but also intellectually, is a system that will not only save money and save lives, but it will also generate jobs and it will revive economies. It's win-win, win-win-win across the board, except for those high-paid CEOs and vice presidents who do nothing but drain money out of our pockets, right? It's a wealth extraction system that we're fighting against. And over the years, for the first 9 years of one-payer states, we were there to provide support for growing numbers of states that were developing and getting traction. We were up to 20 states at one point. And then 3.5 years ago, we converted ourselves to a C4 so that we can be even more powerful in responding to the needs of individual states and regional alliances. We're also organized in terms of working groups, so that folks are welcome from any individual states to jump in. And if you want to work on policy, if you want to work on communications, if you want to work on organization, development, legislation, we're a welcoming organization, one-payer states. So I just want to open up the tent, open up the window, and let you all know that you all are welcome. And I know that Rana was at our last board meeting, as was, let's see, Savan was with us. I know Stefan couldn't make the meeting, but he's on our board. So Connecticut's well represented in the House. Just to pivot back to brief discussion on state-based universal health care, the first component then that we need to get for the states is an ERISA waiver, ERISA, capital ERISA, Employee Retirement Income Security Act. And that's necessary because right now corporations are protected by national law to guard, protect, keep from any sort of inclusion into a universal healthcare system, so long as they have benefits packages with their employees. So it's really critically important that we get an ERISA waiver. And that's one of the core components of the State-Based Universal Healthcare Act. We also want to get funding, federal funding back to the states. You pay money out to the federal government for Medicare, Medicaid, VA chips, federal employees, American Indians. There's some background noise. I'm not sure where that's coming from. In any case, those are a couple of the other components. And then one of the characteristics or one of the elements that Ro Khanna added to the bill, because this bill was previously run by Pramila Jayapal, and then prior to that, it was run by Jim McDermott, two Washington representatives, is that Ro Khanna has added the regional enabling legislation, allowing region or states to work together more effectively. Now, ultimately, the way that this is going to get done, frankly, is not passing the legislation itself, at least not in the near term. But the way it's going to get done is to have these elements, these enabling elements included in the Senate Reconciliation Omnibus Bill that will ultimately be negotiated fundamentally by Bernie Sanders, the chair of the Budget Committee, and Ron Wyden, who chairs the Finance Committee. That's the way the game works in the Senate. The deal is going to be done in the Senate. The question is, are we going to get Manchin? Are we going to get Sinema? Are we going to get Kelly? Are they going to go with the show? That's the real big question right now. I know the filibuster is a big topic as well, but we need to know that those folks are going to get in line and do what's right, not only for for themselves, frankly, for the party, but most importantly for the country. We've got to get the stimulus bill. We've got to get it done for healthcare. We have to get it done for families. We have to get it done for employment. We have to get it done for housing and so forth. But we're concerned with the state-based effort to make sure that the train car, if you want to imagine the omnibus bill, the Senate reconciliation package is a series of train cars. And the train car we're focused on is the one that contains the healthcare legislation, the healthcare elements. And so that's the quick 30,000-foot overview of what the state-based universal healthcare legislation is about. What we need to do is we need to educate ourselves. We need to educate others. We need to elevate the discussion. We need to bring more co-sponsors onto the House bill. That's a critically important element. We also need organizations beyond Medicare for All Connecticut, other social justice organizations in Connecticut to sign on as endorsers of this legislation. I'll put the links into the chat box. So we need to get our House members on board, get organizations signing on as endorsers, and also just a quick pivot and take a look at your US senators. I know that Chris Murphy, his committee assignments focus heavily on Homeland Security and foreign relations.
Let's see if I get any sound. Go here.
I'm sorry. So there's, I guess, somebody's chatting in the background. The other US senator, of course, you know him better than I do, Richard Blumenthal. He serves on a couple of very important committees that are going to have influence and say over what the Senate reconciliation package looks like. He's on appropriations, and the subcommittee that he, I believe, chairs is Labor, Health, Human Services, and Education.
We'll see.
Let's see. I think it's some guy named Charles Pennacchio in one of these boxes. You guys need to rename yourselves. Not everybody's Charles Pennacchio tonight. Can we mute Stefan? Yeah. Okay, thanks. So what we really want to do actually is to get a U.S. senator to run a companion bill, the same legislation in the U.S. Senate to give it greater visibility. And right now we're negotiating, trying to get either Elizabeth Warren or Ed Markey on board, to the two U.S. Massachusetts senators. And this, again, will elevate the discussion, bring more power to bear and public attention and pressure onto, especially Ron Wyden. Bernie's on board with our effort. We need to get Ron Wyden moving. There's a lot happening on Oregon. Our brothers and sisters out there are doing a great amount of work. But Richard Blumenthal, I think, is a good point person in the Senate to go after. Since you've already had him in the House, you've had the discussion, tell him that you understand that Ed Markey and Elizabeth Warren are interested, to encourage them, in fact, to pick up the bill, to take Roe's bill, introduce it on the Senate side, and also to lobby his critical Senate leaders, the chair of appropriations, the chair of budget, the chair of finance. So I think that's it. I'll stop there and we can open it up for conversation after Bevin's made her presentation. Thank you so much.
Great. Thank you so much, Chuck. So, but yeah, I can't wait for that Q&A, and I can't wait also now to hear from Bevin. So just for a brief introduction, Bevin McLeod, co-founder and board president of Alliance for a Healthy Washington. She assisted in the drafting and advocacy process that realized the passage of the Pathway to Universal Healthcare work group. And also she has worked with a multitude of diverse stakeholders, including tribal partners throughout Washington state over the past 5 years to assist in passing legislation that increases affordability on the exchange, increases access to maternal Medicaid patients in the postpartum period, extends health systems transparency, requires cost transparency for drug manufacturers, improves the Indian behavioral health system, and more. Prior to her time at the Alliance for a Healthy Washington, she was program director for Healthcare for All Washington and comes from a diverse background of nonprofit management, agriculture, and economic development work, and advocacy on behalf of refugees and migrant communities. She is passionate about and committed to working on social justice and equity issues, and is focused on fulfilling projects that make our communities more sustainable and equitable for current and future generations. Bevin also holds a degree in economics and international political economy from the University of Washington. Bevin, thank you so much for joining us. The floor is yours.
Thank you so much for that, Stefan. And it's such a pleasure to meet everybody here. Am I able to share my screen quickly, or do you need to give me permissions?
That must make you a co-host for that.
Okay, that would be great. And wow, what a list. It's kind of crazy sometimes to hear your own bio said back to you. Thank you so much, Stefan. I'm going to share my screen here real quick. So super quickly, right before I share my screen, essentially what we've done here in Washington State is we passed the Pathway to Universal Healthcare work group in 2019, and then served on that work group that did some analyses on 3 different models of a universal healthcare system. Model A, of course, being the fully single payer model. And from that, we pulled out what we thought would be the next steps in achieving that in Washington State. And so we were able to draft and get past this legislative session, this past legislative session, 2021, a permanent Universal Healthcare Commission here in Washington State. And as far as I know, it's the only one in the country that is a permanent commission. I, to be honest with you, was pretty floored that we were able to get the support of the chair of the House Health and Wellness Committee. She has long been kind of lip service to single payer and has always said that she supports it, but I've never seen her act on that. This past legislative session, she actually came forward as we were able to get it through the Senate and into the House, and really helped to strengthen the bill. So it was a nice surprise. I thought we were going to have to fight her on it, and we didn't. So this is just a quick, brief summary, kind of the 30,000-foot summary of what this bill does. But essentially, what we are aiming to do is take all of the studies that have already been done, synthesize those analyses, and the commission is to draft its first report and have that submitted within a year of the commission being put into place. From there, the Healthcare Authority is tasked with actually beginning application of federal waivers. So the way that it's stated is that they must begin those application processes within 60 days of availability. Now, I think we all know that technically those waiver applications already exist within the ACA, right? That's the section 1332 for the innovation waivers. So our job is to make sure that the HCA is following the letter of the law and beginning those application processes. There's a lot to this bill that I'm happy to kind of chat through with everyone, but essentially this is our next best step that we could take in transitioning to a single payer system in Washington State. So the commission is also tasked with developing the financing. Each year there's going to be a report from the commission. The other piece of this that I find very strong, that kind of flew under the radar, I think, of a lot of folks in Washington State, is that agencies have the authority to implement any pieces of any report authored by this commission. So and I'm sure this is the same in other states, but agencies can essentially legislate their own laws. I mean, it's not the same code as a Washington state legislative code, but it's the rules. And so rules go through agencies like the Healthcare Authority, Department of Health, et cetera. So think, Medicaid expansion to undocs in the state, think, pretty much any sort of potential expansion that could occur through these reports as we hope to achieve those federal waivers. So this is why Representative Khanna's bill is so paramount to states like Washington that are ready. We've done the studies, we've done the work. We know that a Model A will save billions of dollars annually just to Washington state alone, never mind, as everyone here knows, nationally. So we're ready and we're poised to do this. This commission is set up to get the state to transition. So that's kind of my quick little spiel over the 30,000 foot spiel, as Chuck said. And I'm really would love to kind of open this up to you all, because I think that, I could talk a lot about the nitty gritties and the nuts and bolts, and I'm happy to share the bill itself in the chat if that is helpful. And I can also share this, this page for folks. But I think that often we learn the best when we are able to ask questions. So from my perspective, from Alliance for Healthy Washington's perspective, we feel like any and all support that folks around the country can offer in getting Congress to move, as Chuck pointed out, on these waivers is paramount. And, I think, somebody correct me if I'm wrong, but I think the only state to have achieved an ERISA waiver is Hawaii. And so there's not a lot of precedent, unfortunately. The application is there, but there's not a lot of precedent for states being able to actually achieve that waiver. And as most folks know, in Washington state, we are home to the biggest corporations on the planet. We do not have an income tax. It's unconstitutional in Washington state to actually implement an income tax. It took us decades just to pass a capital gains tax, which finally just passed this legislative session. So we are challenged, I would say, when it comes to progressive revenue options in our state. So getting an ERISA waiver, I think there's obviously debate back and forth on that, which is fine. But from my perspective, I think that's paramount, especially considering the state that we live in. So from my perspective, that's the biggest way folks can help from across the country is really building the movement at the congressional level and making this as loud as we can so that, the Senate has no choice but to adopt some of these components of Ro Khanna's bill into the reconciliation package. So I think I'll just stop there and let folks have some Q&A, and I will put these links into the chat box. Unless there's anything else, Chuck, that you want to say before we go into Q&A, or Stefan, you as well.
Just to add that I did put the key components for state-based universal into the chat, and I put a link for the organization endorsement documents, the Google Doc for organizations to sign on, into the chat as well. Oh, and the third thing is that we're working toward creating a national petition also. So keep an eye out for a circulating national petition in support of this legislation. Thank you.
Great. Thank you so much. And absolutely, I think it's so wonderful, like when there's an opportunity to also work across state lines. So Bevin, thank you so much for your presentation. And for Q&A, usually we use the stack system. So if you have a question, please type the word stack in the chat, and then we can call on you to ask a question. I see Justin Paglino. Go ahead.
Hi, yeah, I wanted to ask more about this idea of regional single payer systems. I find that very interesting because it just, I think, makes it, economies of scale make it more viable the larger the number of people are participating, in essence, correct? I'm wondering, is it feasible that we could have something akin to the National Popular Vote Pact movement, where states are signing up one by one to who want, to elect president by popular vote, and when they get enough electoral votes, they all enter into the compact and give their electoral votes to the person who wins the national popular vote. But so is it, and I've thought of this idea before, but I wasn't sure if it's feasible. So I was encouraged to hear you mention it, that states could potentially team up and pool their resources in order to enact, single payer, I guess it would still be single payer healthcare for all the residents of their states. I would think that might be difficult, getting the states to agree. But I'm encouraged to hear that there's at least some discussion going on, and that it might actually be feasible. So I wonder if you could talk about that a little bit more.
Evan, do you want to start?
Sure. I'm really excited about it as well. I know that Dr. Bill and I have had an initial conversation. There's some other folks in Oregon, including one of the state senators down there. We've initiated a conversation with to really start to have really bring the elected officials to the table, I think, for the first time. We certainly have several here in Washington state who are really eager to begin those conversations about how do we take this regionally. And I think, as Chuck pointed out, having pharmacy starting at the drug cost sharing systems level and kind of expanding from there might be a good first step. One of the things that I am hopeful for is that, at least on the West Coast, during this past year, during COVID, we already have a pact that was created by the Western state governors to be able to distribute PPE and other supplies that were needed on the Western states. And so my hope is to be able to actually use that as a launch pad to actually say, hey, let's make that bigger, right? Let's also take that to a larger level and say, let's get to, a drug exchange program. And then can we get to, maybe we can somehow mesh our Medicaid systems. So I think there's a lot of creative thinking that's definitely there to be had. But let's seize the moment here, and let's not, necessarily reinvent the wheel, but let's use what's already in place and just expand it politically. At least that's my perspective.
Yeah, and during the height of COVID last year, governors and governors' offices were in conversation about how do we come out of this pandemic with an economic growth plan. So if they're talking about economic recovery, you can't talk about economic recovery without also talking about putting in place public health systems, right? The public health system aspect of healthcare in the United States is incredibly weak. It's become weaker and weaker over the decades as it's become ever more privatized and corporatized. But that's an avenue. So governors are in conversation, and there was actually a breakout event. I don't know if you all heard about it, but in the Delaware River Basin, the 4 contiguous states governors followed the Delaware Valley River Basin Commission to ban all fracking activity in the Delaware Valley Basin. It got very little attention in the mainstream media, very little attention. And that's the kind of thing that we need to point to.
Recording in progress.
We need to celebrate that, but also, to your point, Justin, we need to use that as a platform by saying, hey, you did it to ban fracking. You can also do it to create even more powerful bulk purchasing of pharmaceuticals, as Bevin just mentioned, and build out public healthcare connections across the states. There have got to be threads of this that can be done regionally, and building these alliances regionally gets us that much closer to a national solution ultimately. So I know that there were conversations among several of the mid-Atlantic states, from Pennsylvania all the way up to Connecticut. There's an article on the One Payer States list or website. You can just do a quick search over there. And I know that those conversations were happening out west. I think the 3 Western states, and I think Colorado might have been part of that conversation also. But if they can talk about economic recovery, if they can talk about environmental protection, then they can talk about healthcare.
Thank you,
Amazing.
guys. Yeah, I know we have regional energy agreements in New England of how we, our regional energy grid, but I don't know if that would be a good starting point, but there may be other things that I like the idea of trying to look where the path has already been kind of tread a little bit and getting some collaboration going. So thanks, guys.
Sure. I mean, it's a creativity question, right? So, I would, at Medicare for All Connecticut, put your heads together and see what you can come up with. I bet there are other examples that we haven't even tapped.
Great, thank you. And then I would love to hear more about, for example, Bevin, how do you do it in Washington State with your group? The Medicare for All, for example, is like also now trying to apply for the 501c4 status, like recently incorporating. So Alliance for a Healthy Washington, could you share a little bit more about your group? How's the setup, for example, like what kind of membership or committees might you have? How do you do fundraising, or like what other grouping with that now you were even able to pass that bill recently?
Sure. Yeah. So we opted for a 501c4 status so that we are allowed to spend up to 100% of our budget on political activity. Doing my work at Healthcare for All Washington and spending time in our state legislature, I really, saw interest in many disparate groups and organizations in, pushing on the status quo and changing our healthcare system. However, not every organization has the bandwidth to either pay advocates to be an Olympia in that space, or they may not have the bandwidth themselves to advocate at all in that space, or they have niche policy issues that take up the bandwidth of their organization in terms of their ability to focus on issues. But that doesn't mean they don't care about the larger systems reform. And so what I came away with that was thinking, there needs to be an umbrella organization that really pulls these other organizations together, so that when we walk in the door, let's say that legislators in the committee or in the office know that we're representing all of these different organizations, which themselves represent many different residents of the state. We have many grassroots organizations that have individual members and donors. We didn't feel like we needed another one. We wanted to really bring organizations together. And so that's the model that we put forward, was to say, hey, we probably cannot, well, not probably, we can't outraise the status quo. We can't outraise the industry, right? They have billions at their disposal, but we can outpolitic them. And so that was really kind of the focus of, how and why we set ourselves up as a C4. We just incorporated in 2018. So we are a small but mighty organization currently. With our membership, we represent about 215,000 residents of Washington State with our member organizations. And so we have we're calling it open enrollment. We thought it was kind of cute to bring in new member organizations now. And so we just opened that up for applications for member organizations to join. And it's really just on a tiered level in terms of annual dues, dependent on an organization's ability to pay and the size of their revenue. So really for us, we need to be able to, hopefully get to a place where we can pay some staff to do this work, but most importantly, to maintain what we need in order to continue to push the fight forward. So that's how we are organized. I think that anyone who is wanting to really be flexible in the space of policy and politics, would say a C4 is the better route than a C3 because you can only spend up to 20% of your budget as a C3. So just if that's something that you're thinking about, that's the route that I would take, just so you don't have to scramble later. I'm happy to chat about what it looks like to be an advocate. You know, just that's a whole nother conversation and training process. But bottom line is know your elected officials, do your research, do your homework, find out how you can talk to them from their perspective and understand their district. And that's, to me, that's the really key piece in being able to bridge those conversations. I hope that answers all of your questions, Stefan.
Yes, yes, that's great. Thank you so much. Very
Sure.
helpful for us with Medicare for All Connecticut. And I see a stack in the chat from Nancy Greep.
Yes, thank you. Can you hear me?
Yes.
Okay. I have asked this question of other people before, and I get different answers. So the question is, can you request the waiver without having already passed a law in your state establishing a single payer? In California, if we're lucky, we might be able to pass a law, but it's only a policy law. It's not a funding. It doesn't have a funding mechanism in it. So if you do require a state law to have been passed, does it have to be both policy as well as funding, or can you ask for the waiver first?
Well, there is some debate still, Nancy, so it's not a settled question. There is some room for interpretation. The position of Senator Wyden from Oregon, who chairs the Finance Committee, his opinion, his interpretation is that Section 1332 of the Affordable Care Act is sufficient. That it allows states to move forward with innovation and to simply make the waiver requests. But of course, that's going to depend quite a bit on who is the sitting administration, who's the head of Health and Human Services. We want it to be a law that wraps around, that enables states to move forward regardless of the politics, the shifting politics of the nation. And as we know, we have problems with corporate Democrats as well. So it's important to get this instituted as much as possible in statute, in federal law. Then there's no question about it, Nancy. But it's kind of squishy when there's not that law out there. And as Bevin said, the only state that got an ERISA waiver was Hawaii, and that was before ERISA went into effect in 1974. So the other 49 states, have question marks hanging over their heads right now. And that's why we need to convince Senator Wyden that we need to make what it was 1332 more robust and make it look more like 1335 or the state-based universal healthcare legislation as outlined by Ro Khanna. And the key talking points are in the box. And we've been circulating the documents, the talking points, the frequently asked questions, and the actual language of the upcoming bill, which will be given a number in a couple or a few days. That's the way you do it. You introduce it, and then it will acquire an actual House bill. But if you need the information in the short term, you can go to HR 5010 from the 2019 Act. So HR 5010 will give the actual language. It's the exact same language, but we'll get a bill number in a few days. And by way of update, we're now up to 23 co-sponsors in addition to Ro Khanna, which exceeds where we were 2 years ago. And we want those numbers to grow and grow in parallel with the great work that was done in terms of getting members on with Pramila Jayapal's National Medicare for All bill. And just so for people who question the difference between national and state and so forth, we absolutely, at one payer states, and folks who are really thoughtful about this, we look at the complementarity of all of it. It all complements each other. It all works to reinforce the conversation that healthcare should be a human right, that it's a public good, and it benefits everyone across society. It's unfortunate sometimes that we divide ourselves that way. But you know, when the action's on Medicare for all, that's where one payer states is. When we see states moving forward, that's where we focus our energy. We want to see movement going forward. And so this is a longer way of answering your question, Nancy, which is to say that it's ultimately going to take movement politics that gets this done. It's ultimately that's going to get us the statutes, the protections, the enabling powers, the federal statutes, and so forth. We have to grow our movement, and that's really the most critical thing that we need to be working on right now. We need to connect health justice, health defined broadly, but defined in terms of environment, education, policing, and ground level pollution, education. All these issues have got to connect with healthcare justice. If we don't connect healthcare justice to health justice, we're not going to grow and be able to enact legislation that's going to benefit people who are struggling day to day with bread and butter issues, and other folks who may be a little bit more fortunate. And I would say disproportionately, that is the case in our world, where it's predominantly white, progressive, a lot of medical professionals and so forth, and post-professionals. We have to connect our movements. We have to grow. We have to create a massive movement ultimately to win.
How does Section 1332 need to be made stronger? What is weak about it?
Bevin, why don't you take that?
Well, okay, I think you can probably do a better job than me, Chuck, but I think really, as Chuck pointed out, you know, it depends on who the Secretary of Health and Human Services is currently. You know, if states had tried to apply for waivers, and to be clear, there are multiple waivers, right? So it's not just one application. State has to apply for multiple different funding streams. So Medicare, Medicaid, then also the ERISA waiver, et cetera, currently. So that is really, you know, then becomes dependent on who's at the agency level, and therefore what they get to decide about how the state is applying, what kind of state it is. I can't imagine under the past administration, Washington State applying for, you know, a single payer system and being awarded those Medicaid and Medicare dollars as an example, right? Or an ERISA waiver. So what this does is it actually, you know, focuses it truly into a single application, and, you know, would allow states to apply multiple states at the same time. It also requires states to demonstrate 95% coverage within the first 5 years, and then, you know, have a plan to expand to 100% from there. So there are requirements within the State-Based Universal Healthcare Act that do not exist in 1332. So it's really geared toward ensuring that a state is actually going towards a single payer system. So I think, you know, there are states that have applied for like a Medicaid waiver under 1332 for reinsurance programs. In fact, Washington State did apply for a reinsurance under 1332 and didn't make it through the legislative session. But so, you know, I think I want to say Montana, somebody else did achieve a reinsurance or a Medicaid waiver for reinsurance program. But right now it's just very ad hoc, right? And it really is dependent on who's at the agency level. Did I leave anything out, Chuck?
No, I think you hit it. Nancy, is that?
Thank you. That's very helpful.
Okay.
Yes, thank you so much. And then Mike.
Yes, this is a discussion ongoing that can't be answered tonight, but in all the states that I've been witnessing fighting for universal health care, they're articulate, passionate people who sometimes offend one another. And what are guidelines that everybody suggests to achieve productive conversations, true collaboration, and least hurt feelings? I have one suggestion, and that's the book called Crucial Conversations. It has a lot of good guidelines in it. There's also an etiquette article that we can use just for emails, but open for other ideas to help us channel our emotions in the right direction.
All right, great. Thank you so much, Mike. Carrie, you would be next.
Hi, I just have a quick question. You talked about the bill coming up in Congress. And so I'm assuming that those of us from Connecticut, we should call Senator Blumenthal's office and express our support for that. So that I was thinking I would do this week. And I was just wondering if there was any other action items that anyone would suggest that we should be doing for, like, just short term.
Looks like Savan has got something.
Yeah, hi everyone. So actually, I was just going to say there's 2 actions you can take right now. And if you go into the chat, I will put the links in. So we at Medicare for All Connecticut are a sponsoring organization of the state-based universal health care, which Chuck and Mike are part of. And so if you see in the chat now, there is a link where you can click on that link, enter your information, your name, your address, and whatever else it asks you. And that will directly send a message to your legislator, I believe your House representative, to support the state-based universal health care. So if you do that, if everyone on here does that now, we'll have 43 more people than there were before. They'll get 43 notices right now. Then the other thing you can do is, this is an organization that we are also very close with called PNHP, Physicians for a National Health Plan. And they also have, and this is, sort of boilerplate stuff, and it's not just PNHP. There was the one that I found on Google that, again, similar to the one above, you can ask your representatives to support Medicare for All, the 1976, the bill that was introduced by Pramila Jayapal. And that link is right there as well. And it should be noted, if you're in Connecticut, only Senator Richard Blumenthal and Representative Johanna Hayes support any form of universal single payer Medicare for all type healthcare. All of our other representatives, such as Rosa DeLauro, she does not support it. Who are the other ones?
Joe Courtney
thank you, does not support it. Chris Murphy, our other senator, does not support it. So we need to be speaking to these individuals if they'll hear us, or put pressure on them, and taking these actions right now will help. And then we'll talk about other actions that will also help when we get there. And if you have any problem with seeing the chat, maybe raise your hand, or we can always send this information out. These are all also on our Facebook page and all that.
Great, thank you so much. And yeah, what a historic day, kind of like today, the introduction of the State-Based Universal Healthcare Act by US Representative O'Connor, together with 28 co-sponsors, hopefully more soon. And then, yes, so thank you so much, Chuck. Thank you so much, Bevin, for Washington State Report. Chuck, do you want to still share something with us before you head out?
Just that that Ro Khanna has a new healthcare legislative aide, Emma Preston. I dropped her email address here. So she's the point person to direct your members if they want to sign on with the bill or if they want to get more information. Emma is the new point person. It was previously Will McKelvey. So they've switched up in just the last week or so, just to update people. And again, I know that there are any number of folks in this organization here who are attached to other social justice organizations. See if you can bring them on board with the legislation as well. I put that link higher up in the chat stream, but maybe if somebody can pull it and paste it or repost it lower down, and then yeah. So I think it's great. You folks are terrific. We do need to cut out. So look forward to staying connected here as always. And we're having for a monthly call, Michael Leidy, who is a California strategist formerly with NNU, is going to be our monthly speaker. So that might interest folks. It's a noontime call for folks who are working or if you can get off lunch, it's Friday on the 18th. And just to say also that I'm going to be away for the next month, heading out to Beirut, Lebanon. It could be that's my next life move. So I'll let people know what's going on. But we do need folks to step up, as some of us are kind of in positions where we have to step back. I was fired for union organizing at my university. I think people might know that story. So we have to do what we have to do. I'll stay connected, keep working with people. Thank you so much. Appreciate all your great work.
Thank you so much, Chuck. Yes, let's stay connected.
All right, Bevin, I'll send you that link.
Great, thank you. Thanks, everyone. Great to meet you all.
Yes, thank you.